Welcome back. Welcome back to Fire Mike Coding. In this video, we will discuss the basic parts of Medicare and, most importantly, why medical coders should know about it. Medicare is a U.S. government health insurance program that's funded by taxpayers, employers, and government contributions. Now, you do have to meet certain requirements in order to be eligible to receive these benefits. So before we get lost in the sauce discussing basic Medicare parts and the breakdown of these parts, let's first discuss why a medical coder should even know what Medicare is and the parts of Medicare. Medicare is the third largest party payer. So it's pretty essential for a medical coder to know how to correctly assign codes, how to try to avoid as many claim denials as possible, and to ensure that these providers are paid. For example, for Part C, Medicare Advantage, each plan on there has different billing rules. So coders must know how to check these payer policies. So there's four basic parts of Medicare. There's Part A, hospital insurance coverage, Part B, supplemental insurance, Part C, Medicare Advantage, and Part D, prescription drugs. Now, recently I found out there's also a Part F, but that's for another day. Most importantly, just know Parts A through D. So when you hear the word beneficiary, that's the recipient, that's the person that's receiving these Medicare or Medicaid benefits. Now, Part A is for hospital insurance coverage. Usually it's free if you've worked and paid some Medicare taxes. And by free, I mean you still have to be eligible to receive these Medicare benefits. Just to name a few, it'll pay for some inpatient hospital stay, nursing facilities, and some home health care as well. So Part B is known as supplemental insurance, and the beneficiary is not automatically eligible for this plan. Typically, Part B is going to pay for services and supplies that are not otherwise covered under Part A. That could include some doctor visits, outpatient services, some lab tests, and some home health care as well. All right, so now Part C, known as Medicare Advantage. Now, this one's a little different because it's like a mixture of Part A, Part B, sometimes got a little Part D in there too, and we'll get to Part D in a little bit, but it's a blend of the both worlds pretty much. Some benefits that could be included would be dental, vision, you might even have some hearing coverage in there. But typically the beneficiaries, they will choose their own providers under this. There are several different options that the beneficiary can choose. They just kind of find what works best for their lifestyle. But yeah, that's Part C, Medicare Advantage. All right, so the last one is Part D, prescription drugs, and it covers prescription medications. Under this plan, it is something that you can actually add on. You don't have to have Part D. It is offered by private insurance companies that are approved by Medicare. And private insurance company is a company that probably runs an organization that offers health insurance plans versus Medicare and Medicaid. It is ran by the government. For Part D, there is a monthly premium, a copay. Now, some plans have a deductible, but not all plans. It is a lot, but you'll get it. Thanks for watching.